$84 trillion is set to change hands over the next 20 years. Whether you're passing it down or inheriting it, the decisions you make today will shape your family's financial future for generations. Welcome to the Great Wealth Transfer, where David Pulcini, CFP, guides you through the strategies, insights, and pitfalls of navigating one of the largest financial shifts in history. What you don't know could redefine your legacy.
So I am hoping we can get this one out in a reasonable amount of time because we are right in the middle of healthcare premium season. And if you have ever looked at your healthcare premiums and thought, why is this so expensive? Obviously, you're not alone. Okay, whether you're in your 50s, you are approaching Medicare, already retired, you probably know this. Healthcare is one of the biggest and fastest growing expenses that you will face. And today I'm breaking down, hopefully in plain English, why healthcare costs so much, because what is driving these premiums? And then is there anything we could even do about it? So let's try to keep this simple and honest from my own research here. But healthcare is expensive because we use it more. Plain and simple, right? Americans use more healthcare services per person than almost any country in the world. And as we age, our healthcare costs continually rise, and they rise dramatically. More prescriptions, more tests and imaging, more chronic conditions. There's more specialists to see, more procedures and surgeries. And insurers, they know this. So when they price premiums, especially for people in their 50s and 60s, they have to factor in, they do, that there's a higher probability of usage. So the simple version here is the older we get, the more care that we need and the more expensive it becomes for that insurance company, okay? Number two, the price of care itself is higher in the United States, and this is the part that most people don't realize. In the U.S., the price of healthcare, not just the usage, is extremely high. So what am I talking about? Hospital stays are more expensive. The surgery itself, emergency room care, those prescription drugs, the imaging, the specialist visits, all the things, right? They are priced significantly higher here than in most developed countries. Insurance companies, they're not the ones setting these prices. It's the hospitals, pharmaceutical companies, and the providers themselves. So the premiums reflect the underlying cost of the system. So if the care costs more, the insurance to cover it costs more itself, and then our premiums go up, okay? And then prescription drugs are a huge driver of costs, and prescription spending per person in the U.S. is also way above global average. And why is that, we might ask, which we don't have time for that podcast, but new drugs are extremely expensive to develop, okay? And there's no national price negotiation, and patients or folks often stay on medications for years. And specialty drugs like autoimmune drugs or cancer treatments cost thousands of dollars per month. And insurance companies pass those costs through the system to the user, which means higher premiums for everybody, right? And then insurance itself has a layer of administrative costs. And this is one of the least talked about reasons healthcare is expensive. But the U.S. healthcare system has massive, and this is to put it nicely, massive administrative complexity. Every insurer has to, there's billing, claims, underwriting, marketing, customer support, technology, compliance, actuarial teams. I'm going to stop there because I could keep going, but because we have that fragmented system, private insurance, employer plans, the ACA marketplace, Medicare, Medicaid, the administrative overhead is enormous, and those costs also get, we call it baked into your premiums, okay? And then the marketplace plans get more expensive as you approach 65. And this one probably hits people the hardest. If you retire before Medicare, private health insurance can hit $1,200 to $2,000 per month or more per couple, right? Or an individual. And that's because, I think we know this, insurers cannot deny coverage. they have to cover pre-existing conditions. They cannot price you out for your health history. So the only legal pricing factor they can use is your age. And age is the number one predictor of healthcare consumption. So a 62-year-old simply costs much more to insure than a 32-year-old, right? We all know that. So as we get older, the risk pool also gets smaller as people age. So another overlooked reason, healthy people often stay on employer plans longer. Unhealthy people disproportionately use the marketplace. So the ACA risk pool for older Americans it's got fewer people, higher average medical claims, higher expected cost per enrollee, and then again forces the premiums up. And then I want to finish with this. The medical inflation costs outpaces by far regular inflation. For the last 20 years, medical inflation has grown way faster than our wages, Social Security, the CPI, bond yields, fixed income. Even if general inflation is 3%, even if you bump it up, say 5%, healthcare is going up 6 to 10% per year. And then premiums reflect that long-term trend, as we know, okay? So what can we actually do about it? And this is where planning matters. We can plan retirement age around healthcare if we have to, because those most expensive years are 60 to 65 before Medicare kicks in, okay? We can also consider using HSAs or health savings accounts if it's available, right? Which it should be. That is a triple tax advantage, and I'll say excellent for future medical costs. We'll do a separate episode on HSAs. And then we could use income management to qualify for ACA subsidies. So if your income is structured correctly, this can also save thousands of dollars per year. We want to compare plans annually. And then again, understand Medicare's IRMA brackets. Higher income equals higher Medicare. And then I think most importantly is build healthcare costs into that retirement income plan. We want to feel confident about it and know that this will be covered even if all of the bad scenarios happen in retirement, okay? So healthcare isn't expensive because you're doing something wrong. It's expensive because the system is expensive and because as we age, we simply use more care. So what we do is hopefully with the right planning, the right income structure, and the right Medicare strategy, we could control a lot of this cost that you might think we can't, okay? So if you need help building a plan with this that prepares you for healthcare and other retirement income, just connect with us at 6 Point, find us on social media. But for now, make it a great day.
Thank you for listening to the Great Wealth Transfer Podcast. If this podcast resonates with you, reach out to 6 Point Financial Partners at 585-485-6048 or email dpulcini@6pointfp.com.
Content here is for illustrative purposes and general information only. It is not legal, tax, or individualized financial advice, nor is it a recommendation to buy, sell, or hold any specific security or engage in any specific trading strategy. All investing involves risk, including loss of principal. Results will vary. Past performance is no indication of future results or success. Market conditions change continuously. Information here is provided in part by third-party sources. These sources are generally deemed to be reliable. However, neither 6 Point Financial Partners, Private Client Services, nor RFG Advisory guarantee the accuracy of third-party sources. The views expressed here are those of 6 Point Financial Partners. They do not necessarily represent those of Private Client Services, RFG Advisory, their employees, or their clients. This commentary should not be regarded as a description of advisory services provided by 6 Point Financial Partners or RFG Advisory, or performance returns of any client. The views reflected in the commentary are subject to change at any time without notice. Securities offered by registered representatives through Private Client Services. Member FINRA SIPC. Advisory services offered by investment advisory representatives of RFG Advisory LLC, RFG Advisory, or RFG. A registered investment advisor. Private Client Services, 6 Point Financial Partners, and RFG Advisory are unaffiliated entities. Advisory services are only offered to clients or prospective clients where RFG Advisory and its representatives are properly licensed or exempt from licensure. No advisory services may be rendered by RFG Advisory unless a client agreement is in place.